This is Living the Good Life podcast, episode 2003. I'm Kimberly Henrie. Today in our Vibrant Living series, we'll be talking about the benefits of chiropractic, how to choose the appropriate professional technique and professional for you, why chiropractic may be beneficial, and what to do if you can't get to your chiropractor right now. We've got a lot to talk about, so let's get started. Our guest today is the owner of Trailhead Chiropractic, a graduate of the Palmer College of Chiropractic, and specializes in pregnancy and pediatrics with a certification in the Webster technique, and practices torque release technique in his offices at Trailhead Chiropractic, he's the owner, and I think Smoke is the manager. Welcome, Dr. Tom Wessel.
Hi, Kim. Thank you so much for having me on. I really appreciate it.
Oh, we appreciate you jumping on here and helping us learn a little bit more about how we can take control of our situation, our circumstances, and have the best life possible. That's what it's all about, right?
That's the goal, exactly.
Yeah. So how are you spending this time during the quarantine, the stay-at-home order?
We are spending our time just getting outside as much as possible, just enjoying the sunshine. Obviously, we live in a rural area, and so getting outside, enjoying the sunshine, staying active, just trying not to let that boredom take over.
Right. Well, we live in a beautiful place. We all both live here in Colorado, so we are very fortunate. There's a lot of things to get out and do, and a lot of space to do it.
Plenty of space to do it.
That's awesome. And I know you're looking forward to getting back into the office.
Very much so.
What do you think folks should be doing right now if they can't? I mean, we want to talk about chiropractic and why that's a benefit, but there's a lot of folks who can't get in to see their chiropractor right now. So what kind of recommendations do you have for them?
Yeah, so chiropractic is all about adapting the body to deal with stress. And so in a time where you cannot further adapt your body to deal with those stressors in your life, what you want to do is limit your stress even more than you normally would. Now, stress comes down to three things, and that's thoughts, traumas, and toxins. Okay, those are all types of stress. And so, keeping your mind active, not letting those negative thoughts take over would be one part of that. Staying active, staying healthy, exercising, eating correctly so you're not putting toxins into your body. Basically, just living a healthy lifestyle as best as you possibly can will not only increase your body's ability to adapt to stress, but it will also increase your body's ability to adapt to other things such as what's going on right now currently with this virus pandemic.
Right. I love practicing daily breath work. Breath work for me is a total stress reliever, along with the exercise and getting outside. Just brings everything down to a nice, calm, gentle level. Tell me, let's kind of go back to your journey here. Why are you a chiropractor? What drew you into the profession? And what do you find helpful and beneficial about offering that service?
It's interesting. I think you and I have talked about this before. I don't remember, but I was drawn into chiropractic at a very young age. I grew up in northern Wisconsin, and my father was a forester. So instead of paying for daycare, I would just go to work with him every day, and we'd drive all over the state and walk through the woods. And I always noticed that I couldn't keep up with him at the beginning of the week. About midweek, I was out in front of him, and on Thursdays he went to his chiropractor, and on Fridays I couldn't keep up with him. And I had no idea what that guy was doing to my father, but I said I wanted to do it.
Fascinating. So you actually saw from a young age the benefits.
Yeah.
In
exactly.
real time.
Yep.
Now, does everybody experience that kind of real-time benefit?
Every person in every case is different, right? I mean, one person can come into the office and their body it's different than literally every other person that has ever walked through our doors. So some people experience immediate results. Those aren't as common. Some people it takes a couple of weeks. Some people it takes even a couple of months. Every single person is different. And what kind of shape they come into the office in also plays a huge role in that.
And I imagine that's part of what they discuss with the chiropractors, what that looks like, where they're at, and how they're going to proceed and hopefully progress.
Absolutely. And we do as much as we can here for you. But I mean, everybody knows that if you're going to the chiropractor to get rid of, say something simple like lower back pain, but you're overweight and eating McDonald's every day. I mean, you got to work with us, right?
What? You mean I have to do my part?
Exactly.
No good, no good. So I didn't know this until I met you, that there's different tools and techniques within the umbrella of chiropractic. How does a person choose or decide who they're going to see, how they're going to find the right fit?
So yeah, that's a really good question. Honestly, the right fit is the person that you vibe with. It really is. If you don't like your chiropractor, you should find a new one. And that goes for anybody under my care as well. If for some reason we don't vibe, they should be looking for somebody else. But honestly, when it comes down to things like technique, neurologically based techniques, it is my opinion that they are the best. I mean, the nervous system does control and coordinate every other system, tissue, cell, organ in the body. And that's where chiropractic shines, and that's why we're able to see people not with just back pain and neck pain, but also digestive issues or anxiety, all sorts of things. But when it comes down to choosing, it honestly depends on what your goal is. If your goal is a short time, or short term, one time, quick fix, I've got this kink and that's all I need, maybe a neurologically based technique like what we do wouldn't be the best, which, again, that's not necessarily where chiropractic shines. If you're looking for a healthier lifestyle to add health to your life, to increase your body's optimal potential, then that's where neurologically based technique comes in.
So you're more of maybe a preventative wellness strategy versus, not you specifically, but the techniques that you use, the torque release technique, the neurologically based chiropractic, that's more preventative care. Is that correct?
I wouldn't say it's more preventative care. It shines with preventative care.
Okay, great. So you also work on chronic conditions and other conditions in the body.
Absolutely. And we've seen incredible results with that. That stuff, though, as everybody can assume, takes a little bit longer. Chronic conditions that have been there for a really long time, it's not a snap of the fingers and everything's gone.
Mm-hmm. So I'm going to put you on the spot a little bit. This is something I still continue to hear to this day, and I've heard over and over my few years on the planet. And that is that chiropractic is just a place where you go where you get roped into coming back over and over and over again. How do you respond to that?
Roped in, it is, I can't speak for every chiropractor, but it is never our goal to rope somebody in.
Maybe a poor choice of words, right?
I would prefer that somebody chooses to come back over and over again. And the reason is not monetarily benefit. It's because, again, that's where chiropractic shines. We always relate it to brushing your teeth. If you wait until you have a cavity to brush your teeth, and then you only brush your teeth until the cavity is gone, that's not good for your health. Your teeth aren't gonna last too long, right? Mm-hmm. Same thing with chiropractic. Any issue that you have going on, if you wait until you can't take it anymore, and then you just go until the issue's gone, well, I think we all expect that issue to come back. And like I said, chiropractic shines, especially torque release technique or neurologically based technique. They shine when it comes to preventative care. And so keeping your body functioning optimally, instead of waiting until you're overweight and have digestive issues, you start eating healthy. Why don't you just eat healthy the entire time? Does that make sense?
Mm-hmm. Absolutely. What can someone expect when they first start a chiropractic relationship over the course of maybe the first couple of visits versus over the next 6 months?
That varies widely depending on the office that you're going to. I can't necessarily speak for all the offices in our area, but when you come into our office, typically what we do is we give you a brief tour of the place just so that you're comfortable in it, and then we sit you down and go through an entire consultation, figure out what exactly the issue is, if there are any issues, everything about those issues so that it can lead us in the right direction. We do a series of assessments on you and basically give you a short little education on how what we do can help you. And then from there, we decide if any further studies are needed. And then I sit down with you and go over everything and tell you exactly what it's going to take to get you to where you want to be.
So that's on your first visit or two.
Yes, correct.
Yeah. So
And
what kind
then,
of
oh, go ahead.
results, what kind of results come then after that?
After that, in our office, it's just adjustments.
Okay.
We don't do any physical therapy, massage therapy. That's we reserve that for the people that went to school for that. I
Hmm.
went to school for chiropractic, and so that's what you're going to get here. We don't charge you for this and that on the way out. Here, have a supplement. It's just strictly adjustments, X-rays, and assessments is all you're ever going to get charged for in our office, and so that's what basically the rest of that care plan would look like.
Interesting. I'm going to stay away from the topic of supplements because I think that widely varies as well, depending on practitioners, right? A lot of practitioners are speaking out right now about supplementation in light of this virus. And I know that that's not something that you're focusing on in your office, that you're really relying more on the techniques that you practice.
Correct. And I just want to make sure that I just want to be clear. I have nothing bad to say about supplements. I think that a lot of
Right.
people should be using supplements. It's just that, we're going to, here in our office, we're going to save that for the experts.
Okay. Focusing on what you do best.
Exactly.
Absolutely. Yeah. I know that you've got so many stories that you love to tell. I'd love to hear a couple of your favorite stories that you can share with us without breaking confidentiality.
Absolutely. Absolutely. So let me think. So I'll share a couple of them with you. One of the more recent ones, we had a woman come in. She's in her mid 30s, and she had such severe neck pain that she wasn't able to put her car in the garage because she had to back it in, and she couldn't turn around to look behind her. And this woman's only in her mid 30s. Living out here in Colorado, loves skiing, hiking, couldn't do any of that. And she was actually referred for surgery by another chiropractor. And she came into our office, kind of a Hail Mary type deal for her. And after about 6 weeks of treatment, she was back on the ski hill and putting her car in the garage. And it just brings tears to my eyes how quickly her life was changed. I mean, mid 30s, she should not be going through that stuff.
So, how much can you tell us about that? Because that's amazing. Somebody's looking at surgery, and within a matter of time, I'm assuming she did not go through with surgery.
No, she did not.
So, how do you explain that from one? And I know you can't speak for another chiropractor, but from one person's position, she needed surgery, and then you were able to turn that around for her. How do you explain that?
So that again comes down to technique, and by no means do I mean to say anything bad about any other chiropractors. By
Right.
we've had practice members in our office that didn't see the results they wanted and had to go seek out other chiropractic care, and that's perfectly fine.
Okay.
It's just kind of you got to find the one that works for you, and it's kind of a trial and error basis when it comes to that for the individual person. For example, when if two people have a headache, one person might take ibuprofen and the other one takes Motrin. Just one works for one person and not the other person. There's no way to scientifically examine that beforehand without again running a trial and error basis.
Okay. And can you talk a little bit about the technique that you use and how that's different than what others might practice?
Yeah, so again, what we use is torque release technique. So it's a neurologically based technique that was actually developed in the 90s. It took 15 different techniques from chiropractic and kind of combined them into one. And it's like I said, a neurologically based technique. So instead of just, the patient coming in and pointing to where it hurts and us adjusting there, what we do is we look at the nervous system, the nerve flow, the communication between the brain and the body to see where there is a blockage per se. We remove that blockage so that the brain and the body can communicate, and that frees up that communication again to every muscle, organ, tissue in the body.
And you use a little tool. I've seen your tool.
Yeah, we use it's a spring loaded instrument. It's a little bit bigger than a pen, and basically what that does is it allows us to be a lot more precise. Okay, because traditional chiropractic, using your hands for manipulation, the hands are huge, right?
Yeah.
But this pen type instrument, as I'll describe it, has a very small point on it, about the size of your pinky finger. And so we can be a lot more precise. And so then we don't need all that mass going into your body, making all that noise. The adjustments are much more gentle. People find them a lot easier to take. A lot of times you're not sore afterwards, like with a traditional chiropractic. And we can get those results quicker because we're affecting one bone and one bone only, instead of, kind of pushing on everything and hoping something happens.
Okay. Well, that's amazing. That story about the 30-year-old woman avoiding surgery is just amazing. I was taught a long, long time ago that anytime you can avoid somebody cutting into your body, do that.
Oh, absolutely. I mean,
Right?
there's no going back after that, and I'll be the first one to admit that some people may need it.
Right.
But, if you haven't exhausted every other avenue before that, then I wouldn't go through with it yet.
Yeah, that's amazing. And I know you've got more stories to share with us.
I do. One that I just thought about, a woman that has been coming in almost since we opened. So probably about 6 months she's been coming in. And she originally came in because she had trouble swallowing. She could not eat solid foods, and she was having panic attacks daily. And she actually just had her most recent progress assessment, where we rerun the assessments and talk about what's been going on in her life, how care has been going and proceeding. And she reported that both her anxiety, her panic attacks, and her swallowing problem had completely resolved. They had been getting better throughout care, but after about 6 months, completely gone. She's back to eating solid foods and going out and enjoying social events without panic attacks, which is just incredible. Again, it's just life-changing.
Mm-hmm. That's got to feel so good to be able to make such a difference in someone's life.
Oh, absolutely. And that's why we're doing it. I mean, it's just it's hard when everybody comes in on their first day in the office and they tell you this is wrong and that is wrong. But then after, the first, second, third progress assessment, when they're saying, I can do this again and I can do that, it's just, it literally brings tears to my eyes. It's so exciting.
Wow, that's amazing. So you are located here in Glenwood Springs, Colorado. If someone is listening outside of the area, what do you recommend they look for when seeking out chiropractic?
Honestly, I would look for a chiropractor that doesn't sell every single thing under the sun, just because they generally seem to be a little bit more principled. They're not trying to make a quick buck off of you per se. So somebody, like I said, that doesn't sell everything under the sun. We've also got a network of chiropractors that we actually refer to. I know most of them personally. There's about 300 offices across the country. And if people would like to, they can go on the website and find them. That's ampednow.com/find a chiropractor. You can just type in amped map, AMPED, on Google, and it'll probably come up.
Okay, amped map. We'll include that link with our show notes so you can just find it right there.
Perfect.
Make that easy. What else do people ask you, or have you seen that we haven't covered yet today?
What else do people ask me? It's just a lot of lifestyle questions. And I think, honestly, all the people that ask those types of questions, I mean, we all know the answer. It's just that they're looking for verification. We're afraid that the common sense that we know has been put down by science, which is almost never the case. If you're getting exercise, eating healthy, you don't have a lot of mental stress, you're going to have a healthy lifestyle. And honestly, that's just what it comes down to. That's just, that's what chiropractic is just adding to that healthy lifestyle. We get individual questions like, should I use this pillow, or should I take this supplement? Mm-hmm. And, I have general advice for that. But again, when it comes down to specifics that aren't in my field, I'd much rather an expert in that field answer those questions.
Mm-hmm. So who would you send someone to talk to about some of those things? There's not a lot of trust, I think, when it comes to alternative therapies out there. So do you have specific resources that you refer to or that you would send people to?
We have specific people here in Glenwood that we refer to,
Mm-hmm.
nutritionist, massage therapist, Yoga is really, really good. We've got a yoga studio that we refer people to. But we have our little group of people here in Glenwood. But honestly, when it comes down to that kind of stuff, I mean, it's kind of just do your research, because they're all these places, including us, are businesses. And you just got to do your research on the business. Nutritionists are obviously the head honcho in their field, in the field of nutrition. So that's who I would refer to when people are talking about specific diets. Does that answer your question?
Oh, I think so. And it actually brings up another question. And when talking about nutritionists, the field of nutritionists and that label varies widely depending on the location you're in as to what kind of certifications they hold. I know in some areas you can call yourself a nutritionist with zero certification whatsoever. What about chiropractic?
I'm sorry, what about it?
What about it?
Can anybody call themselves a chiropractor? Is that your question?
Yeah. What kind of certifications does it require?
I see. So to practice chiropractic, you have to first have a bachelor's degree from an accredited university, college or university. So that's 4 years. And then after that, you have to go on to get your doctorate. So it is actually a doctorate degree. There's about 17 colleges or universities across the U.S. that are accredited to teach chiropractic. Palmer College being one of the most, if not the most notable. That was the first one back in 1895 is when it was founded. But no, it's very, very regulated. You have to have, all your licenses, go through your background checks, pass your board exams. It's just under 8 years of schooling, but that's with skipping all of your summers through your graduate program.
So it is the equivalent of a medical doctor as far as training.
It is. So the difference basically is that the first 2 years are very, very similar, where chiropractors and medical doctors are learning so much about the human body and how it works. And then after the first 2 years is kind of where it splits, where medical doctors go on to learn about pharmaceuticals. Chiropractors go on to continue their education about the human body and specifically the nervous system. There's a lot of emphasis on the nervous system, the brain, and the spinal cord, because again, that controls everything in the body, and that's our expertise. So that's where it differs. And then after that, they both have residencies. Medical doctors have a little bit longer residency depending on what they're going into. Chiropractors can actually start their residency while they're on campus seeing patients, and then they can continue it at a series of offices across the country.
So we should definitely feel safe in your hands, for sure.
I would hope everybody does.
We've got just a few minutes left, and I want to summarize a little bit. I think when folks think about chiropractic, or some folks, I won't speak for everyone, we tend to think of, just getting that spine in alignment, cracking the back because your back feels like it's out of whack. But in talking with you and knowing you and having had these conversations, there's so much more that you can address. You want to just highlight some of that really quickly in a quick summary?
Yeah. So, I mean, honestly, and I hate to, just kind of give it a big general blanket, but it's literally just about anything, we can help with. And I'm not saying that we treat everything. We don't really, we don't treat anything. All we do is get your brain, your body in better communication so that your body can heal itself. Nothing crazy voodoo about it, but your body was made to heal itself. When you get a paper cut, the Band-Aid doesn't heal it, right? Your body does. And so that's all we do, is we try to increase that communication between the nervous system and the body so that the body can heal itself. And so we've seen incredible results with, ear infections in children is a big one, colic in children. We've seen a lot of digestive issues, anxiety I talked about earlier. Headaches are a huge one. We've seen, skin problems, immunocompromised people, and we've seen varying results with all of these conditions.
Fantastic. Thank you so much for spending some time with us today and educating us a little bit about the wider world of chiropractic and your specific techniques.
Absolutely. Thank you so much for having me on, Kim.
I hope you found a nugget or two in this conversation to help you along in your vibrant living journey. I love the concept of chiropractic for optimum wellness and the tip in finding a chiropractor that you vibe with for the best possible care. Thanks again to Dr. Thomas Wessel for educating us today. You can reach out to Dr. Tom at trailheadchiro.com. That's trailheadchiro.com. As always, special thanks to Fruition Studio for supporting us. Fruition Studio specializes in heart-centered marketing and content creation. Learn more at fruitionstudio.com. And to hear more episodes of this show or to reach out to me, visit kimberlyhenrie.com. That's it for this week and this episode of Living the Good Life. Thank you for joining us.